We should use a brain-first approach to addressing primary pain because it's generated in the brain, and now we could hijack that same machinery that generated and sustained it to reverse it using a holistic brain-based approach.
This pain is coming from the brain. And we know this in functional MRI studies. You could see changes that have led to this understanding. So that's where we want to focus. We want to take our focus away from the back or the wrist or the head in the case of headaches, or the foot in the case of plantar fasciitis or other problems that go away with these techniques, and turn our attention to where the problem is. So the problem's in the brain, and so that's clearly where we should be paying attention. And there are a lot of ways to retrain a brain. I like to tell people that the part of the brain we're trying to retrain is not your cognitive brain. This is your subconscious brain or your autonomic nervous system. That's what's running you all the time. That's what's keeping you alive, keeping you safe, sending warning signals like anxiety or pain to let you know when there's a problem. It's a very subconscious part of your brain down there, your primitive survival brain, and it learns differently than your cognitive brain. The cognitive brain learns by reading a book, watching a lecture, going over your notes. But the subconscious brain, the autonomic nervous system, learns by experience and repetition. So we want to use a different set of tools to retrain it. We want to use some experiential tools. We want to use some practicing, doing things tools. It learns by doing, not by thinking. It's not an intellectual part of your brain. It's a very sophisticated part of your brain, this primitive survival brain, your autonomic nervous system, super sophisticated, but it's not intellectual. And so we don't want to use intellectual exercises, and we certainly don't want to use treatments that focus on treating a problem in the body. We've ruled that out. We've done some basic due diligence. The problem isn't in the body. We turn our attention to where the problem is, and naming it where it is can help it get better. So we have to turn to the brain to treat this kind of pain.
Well, we're matching the treatment to the diagnosis. If you have a diagnosis of what we used to call pseudoseizure, or now we're calling paroxysmal non-epileptic attacks, would you give anti-seizure, anti-epileptic treatment for that? No, of course not. That's the wrong diagnosis. The diagnosis is a conversion disorder. The treatment is psychological. The treatment is cognitive and behavioral, not medications. But the question also is, why not? Why maybe are there times when it would make sense to not give this kind of treatment first? Someone's having headaches or stomach pains, and it's not severe, it's mild. They may respond to simple measures. The patient may not want to hear about brain first treatment. They may not want to think about therapy or behavioral modification or anything like that. They may not understand that it's their brain. And maybe they don't need to if simple low-cost measures will work. A lot of times, simple and low-cost measures do work because the placebo effect is very powerful. So if it's stomach pain and you get a PPI for a while, okay. Or you take some over-the-counter pain medications for headaches. We do want to avoid sending people for costly, risky, and invasive procedures for primary pain. This is a big problem, and we see this all the time. But when low-cost treatments haven't worked, when the only alternatives are risky or invasive procedures, please, if we can explain this brain first problem to the patient with love and care and kindness, and they can get it, then they can have amazing results by taking the brain first approach.
I think it's also very important for patients to experience an approach that is not just one thing. It is not just an ice pack or an ibuprofen. It is exercises, the mental coaching that Lynn Health offers. When you put a multidisciplinary team together to really help the patient is going to feel much more empowered to be the leader of that team, the leader of combating the pain that they experience, and less the kind of passive victim of somebody whose pain needs to be fixed.
By addressing our thinking patterns and feeling patterns and behavioral patterns, we can harness the amazing neuroplastic potential of our brains to modify our experience of pain and heal it.
So now it should be quite clear that primary pain is generated in the brain, and we harvest the power of neuroplasticity to reverse primary pain through behavioral and cognitive interventions. This is going to restore the power and control back to an otherwise helpless and hopeless, painful population.